Welcome back to Fello's Thinking Differently podcast. I'm your host, Alex Ficcari, and today's conversation is about celebrating Fello's 65th anniversary. Fello has championed the rights of people with disabilities and supported community development initiatives for over 6 decades. Today, we'll explore Fello's past, present, and future, from the legacy services that launched the organization to how they're living with their mission today and the innovation shaping their next chapter. To celebrate Fello's 65 years, I'm joined today by Jonathon Rondeau, who's the president and CEO of Fello. Jonathon, thank you very much for being on the show today, and congratulations on 65 years.
Thank you for having me. Yeah, it's very exciting to be celebrating.
It's quite an amazing achievement, and what I'm excited today is to take people on this journey, right? And so let's hop in our time machine and go back to 1961. Let's talk about, the amazing work that they've done today, but let's start there.
Yeah, so Fello was started by a group of parents who envisioned a different life for their children with disabilities. And what they really wanted was equity and access that their children without disabilities had at that time. And so I like to remind people of what was happening in the late 50s, early 60s, particularly in Anne Arundel County. There wasn't any law that required free and appropriate education for kids with disabilities. So sometimes it happened, sometimes it didn't. Pediatricians were often telling new parents who had children with disabilities that they were a burden and that they should be sent to an institution. And we don't think of the 60s as that far away from present day, but that's what was happening. And so a group of parents got together and said, we want to do something different. We want to be the catalyst that's going to change how our community functions. And we want our children with disabilities to be fully included. We want there to be equity. And that really was the foundation of Fello and who we are today.
Now, what about where did advocacy and services look like in the early days of Fello, and how do they compare to today?
Yeah, so Fello wasn't started to be necessarily a provider of services. Today we provide a whole array of services, but really what it was is focused on how do we change what's happening in our communities so children and adults with disabilities could be fully included, and that really was the focus. There was a lot that our founders did to help start other programs that focused on services for people with disabilities. But Fello really focused on those first 10 or 15 years on advocating for inclusion in education, in daily living, in employment around that. And it wasn't until the mid-'70s that our first program started.
So, Jonathon, could you tell me a little bit about the legacy programs that continue to resonate today? And maybe you can share an example of a legacy service that has been reimagined or expanded since their inception and meets the modern needs.
Yeah. So I think a legacy service that we've been focused in on since our founding in our first program that we provided, which was housing, which housing is a huge need for everyone today. But for people with disabilities, it was a real focus early on. And that's something that we're focused on, both the creation of housing through Fello communities, providing inclusive, equitable, affordable housing for people, but also the wraparound services for people with disabilities that our Living Options and Services do, or our Community Supports Program does, depending on what level of support you need. And so we will continue to be focused in on that.
Would you say your values or mission has evolved over these years?
So our focus on equity and inclusion and creating communities that people with disabilities can be fully included in is the foundation of who we are today.
Right.
But as an organization that's 65 years old, of course we've evolved. We all evolve over time.
We better.
But I think our core of who we are hasn't changed. I think we are a lot more focused on our values, on how we how those values mean for both the people we serve and our employees. And how do we show up how are we responsible in the diverse communities that we serve? And so there isn't a one size sort of fits all approach, but things that are more elastic, but foundational to who we are.
Is there something you'd say that hasn't changed? It's something that's core that hasn't changed in your mission this whole time?
So I think what's changed is that people with disabilities are the center of the work that we do.
Okay.
That at the end of the day, they're our customer. They're why we do the work that we do. But we also have to acknowledge, and this is where the evolution has, that people with disabilities live with families. and families live in communities, right? And so we need to affect change at each one of those entry points, right? Because you can't just look at something in isolation. And I think the field in general of human services, not just for people with disabilities, has become over the last 10 or 15 years a lot more holistic and looking at the whole person. I think we also, as a organization, have as well. But at the end of the day, the person with a disability, whether they're a child or an adult, is always the center of the service, and they're always the focus of what we do.
That's great. And kind of transition from the past to the future, present, I should say. You think if there's four main services, right? We have Fellows self-directed services, Fellow services, we have Fellow communities, and we also have Fellows behavioral health. Right. So what I'm kind of curious is what are the origins of those services and how they've evolved to today?
So I think what's core is our services or lines of business or how we support people with disabilities has evolved over time based on what the communities we're serving say they need,
right?
But also what people with disabilities and their families say. And so starting with our services, our first program that we started was what we call now Living Options and Services, where we purchased an initial house where we were helping people with disabilities get access to quality, accessible housing. We still own that house today. It's now a duplex, and sort of evolved our services there. We weren't necessarily creating services that already exist in our community,
sure,
but enhancing or adding services. And then sometimes over the last 30 years have started adding additional services that may exist because people with disabilities are saying that they want choice. They want choice in provider, they want choice in opportunity, and so focused in on that. And I think that's sort of almost 20 years ago when self-directed services started, where we're supporting people with disabilities to make their own choice and hire their own staff and providing that back office support, was an evolution of services and people wanting a new opportunity. And,
okay.
Fellow went to the state and said, hey, can we pilot this? And that happened almost 20 years ago today. And then the evolution continued in 2020 with the creation of behavioral health. Prior to COVID, we were struggling to find behavioral health providers that could support people who had an intellectual and developmental disability and had a mental health issue. And so then COVID happened, and it only put a spotlight on that challenge. And so we started our behavioral health program that is specifically, clinicians are specifically trained and support people who have an intellectual and developmental disability and a mental health piece.
And say I love that because you essentially have taken a legacy service and then evolved it with the needs and in the conditional environments we're sometimes surrounded with and surprised by. So that takes a lot of drive. And I mean, it takes a lot of passion and focus. And so to get Fellows team on board, I mean, that's a big cultural component of who you guys are. I'm really interested in hearing from a organizational culture as well as a leadership culture over the years. What has changed to keep that momentum up?
I think over the last 8 years in particular, our focus has really been about how do we balance, particularly our leadership, our leaders balance meeting our mission, but also realizing that we meet our mission through our people. And so how do we balance those pieces, right? Like we talk in our society a lot about balance, but but if one is over supported or under supported, the other isn't going to work. And so we've been really sort of focused in on that. And what our employees are saying in our last employee satisfaction survey is really saying that they're really connected to our mission. That's what drives them each and every day around that, right? And that if we're really going to talk about people with disabilities having a sense of belonging in their community or where they work or where they learn, our employees need to have a sense of belonging of where they are. And I'm proud to say that our employees are saying that when they come to work at Fellow, that they feel like they can bring themselves and have a sense of belonging. And so I think that's what's changed is, right, people was always a clear component of that, but our focus and our investment in our employees, while it's not our sole mission, is connected to our mission if we're going to affect change for people broadly in the community.
Yeah. And it's everything about Fellows about people, right? The people who serve, people who have. And so I'd love for you, I'd love what we're talking about employees, but maybe you can give me a specific example of how you're investing in the employee.
We've increased benefits, reduced the cost of health insurance, made both urgent and primary care free and accessible to our employees, made
Phenomenal.
mental health care free and accessible to our employees, helping them meet the needs of themselves and their family. So when they come to work, they can give of their whole self at work, but also to keep themselves healthy and be able to sort of navigate that. We've also invested a lot in not just providing training. Fellow has always done training, but thinking about that more from a lens of how does this build your professional development? How do we look at every position in the organization as professional positions and say, how do we help you grow? So creating a career ladder for our direct support professionals, creating leadership development programs, creating opportunities for people to take optional trainings and development, and offering things like tuition reimbursement and professional development reimbursement opportunities. So really thinking about what do people need. And there's obviously a benefit to Fellow and the people we serve by having a better trained workforce. But I think at the end of the day, it tells our employees that we're not just, you're doing really important work, but we're also invested in you.
Yeah, no, that's great. And, you know, the other aspect of this is that this has been under, it takes a team, but, you've been at the helm now for 8 years, right? And what I'm really kind of curious is from your vantage point, because you've mentioned some great programs and, initiatives for the employees, but what is maybe the one thing, or in the recent years, something that's really stood out to you as your most successful moment?
So I think our most successful moment or moments for me are when the people we serve are meeting what they envision for themselves. So over the last 8 years, multiple couples have been able to get together, either get committed to each other or get married, and then Fellow is supporting them on what that is. So in many cases, it's finding housing that they can share together that meets their unique needs. It's helping them navigate what that means to live with someone, or helping someone start or maintain their own business around that, even during COVID and tough economic times. Or whether it's helping someone sort of transition from high school to being an adult. And what does that mean in getting the first job? And your first job isn't always your last job, right? And,
Very true.
And how do we navigate sort of those life challenges? I think for me, that's what I'm most proud of that, is the work that our team does, but the work that people with disabilities do to go down those paths, to do those hard things in life, and to share what they envision for themselves and advocate for what they need to be able to do that.
Yeah. And I also think about the industry as a whole, right? I mean, there's a lot of trending news, things catch, and people awareness is definitely higher for people with disabilities nowadays. And I'm kind of curious, how's your work and everything that Fellow's been doing, and how's the industry as a whole been changed, especially, with people's expectations of people with disabilities?
So I think I'll answer that question in two ways. Okay. So I think people with disabilities see that the world, they should have opportunity just like everyone else. Right. And that fact that people are non-forgiving about that and wanting that opportunity is fantastic, right? And people are much more engaged, right? So people who are graduating high school and have a disability or coming into services, our adult services now, are very different than people 10 years ago, 20 years ago, around what the opportunities that they've had in school, for the fact that they've been fully included, the fact that there's a lot better transition services and things like that. And so I think people's expectations, they're really high, and they expect providers and organizations like Fellow to meet those, right? And so that's great, but that's a challenge and transition at times around that. And I think, but that makes us better as an organization. And at the end of the day, that's what we're all about. So I think that's one. I think the other is the last 8 to 10 years have been challenging in the world that we live in. So not only have we become more polarized as a society, we lived through a once-in-a-lifetime pandemic, and there's still 5 years later adverse outcomes because of that. It's been a very challenging economic time for any business to be able to grow and thrive is not easy during those pieces. And so all those layers has made Fello to have to rise to those occasions, but also to be more sophisticated and to
Well said. Okay.
be more, but at the same time, be able to be nimble and be able to pivot and respond and keep focus on sort of where do we want to go, and when those challenges come up, figure out how do we overcome them and still move forward.
You know, I'm always feel like when we're having these interviews, we learn so much about the successes. And what would really, I think, resonate for us and our viewers here is, can you maybe share a story, about, the decades of services that you guys have been providing, and then maybe as a little bit of that experience, how does it transform somebody's life?
There's lots of examples about how our services transform people's lives. I think it's from someone who years ago moved out of an institution and had lived in an institution most of their life, and in their 40s got the first sense of independence of being able to live in an apartment on their own, right? And getting to be able to explore what work looks like, right? And can you imagine not having those opportunities until you're 40? And so there's a number of people today who are in their 60s or 70s that's how they came into our services, right? Around that. We have a big group of 20-somethings who are getting a wide variety of services for us and are going through the same life things that every 20-something goes through, whether you have a disability or not, right? Not understanding who you are or what you want.
We all go through
that sort of change and evolving. But I think, but what I appreciate and what I'm proud of at Fello is that our direct support professionals and our support teams are working for people to realize that there is dignity in those risks of trying, of navigating a relationship and it failing, trying a job and it not being the right one, moving out and realizing, I kind of want to move back in with mom and dad for a little while, right? Like those things, right? And at the same time, there's those success stories where people have really planned in their 20s and move out to their first apartment and are quite successful around what that is. And so there isn't one story, right? There is a whole sort of kaleidoscope, right, of different images and colors and things like that happen every day. We serve over 5,000 people, right? And each life matters. Each story matters. And I think that's what I'm most proud of as we look back at 65 years and what I look to where we're going in the future.
And that leaves such some amazing long-term impact to people's lives. And it is really inspiring. And so you mentioned earlier at the beginning, we would talk about advocacy, right? It wasn't necessarily the focal point, but now when we talk about Fellows providing services, but how has Fellow been involved in like legislation, because we talk about the mindset of people back in the 60s and 70s and 80s. What is Fellow's role today when we look at the Maryland legislation session starting up soon?
So Fello works in partnership with people with disabilities and self-advocates, and we help sponsor and facilitate a group of self-advocates at Fello. Around that, we work with families. We work in partnership with a bunch of different coalitions and other organizations that are advocating for the rights and access for people with disabilities at the local, state, and federal level. And so we do all that in partnership, right? Because we're in this together. But at the end of the day, our focus is how do we raise the voice of people with disabilities? So that's always at the forefront of that. And what the challenge with that sometimes, though, is that as we talk about Medicaid and other things, they get very technical and wonky, and we sometimes lose sight of what does those technical wonky things actually mean for someone with a disability? What does that mean for someone who gets services for an organization like Fello? And I think that's a little bit of how our advocacy has moved from 65 years ago is we just want to be included, right?
Right.
Like, and we need a seat at the table. Now that that's happened, now we can't make decisions without thinking about us, right? And what does that mean? And
here's our voice.
Every piece, every decision impacts the life of someone with a disability, whether that's access to accessible restrooms in public facilities, whether that's access to sports and educational opportunities, whether that's housing, all those and oftentimes nuanced regulations or policies is our job to help translate, but do it in partnership with people with disabilities.
No, that's great. And so we've gone from the past, we talked about our origins, to the present of who we are today. Let's transition into the future a little bit. And how do you see yourself using the legacy of Fello in your steps moving forward to new initiatives in this upcoming chapter?
So I think in many ways, while our focus of our work has evolved over the 65 years, our business model is still the same. At our core, we look at, when we think about expanding or adding services or what should be next, is what's happening in the communities we currently serve or the communities around the communities we serve that Fello could sort of meet those moments, right? And so whether that's looking in other counties or cities around what housing they need, and housing that includes people with disabilities, and making sure that people have access to quality, accessible, inclusive, affordable housing. But it's also looking at how do we increase access to behavioral health and other sort of related services. And so as I think about Fello's future, it's really around with that same lens. The other piece that I think is particularly of a focus for us is people with disabilities are living a lot longer, right? And what does that mean around sort of for someone to age in place? Someone with a disability 15, 20 years ago, the oldest person we served was in their mid-60s. Today, the oldest person we serve is almost 90.
Nice.
Right? And there's a fair amount of people in that 70 to 90 bracket. Well, the supports and services they need are different than they needed 10 or 15 years ago. And so what does that look like? How does Fello provide that? And how do we support that thing? And how do we integrate physical health and behavioral health and mental health and social health all together? And so I think those are, as I think about what Fello will focus on in the future, I think those are some of the things.
So that to me brings us into like emerging needs, right? And so from your vantage point, how are you looking at strategic goals and innovation, and what are you most excited about that allows Fello to still keep its origin missions, but support those emerging needs that are coming up?
Yeah, so I think there's two pieces. So as we think about that, and as we've grown as an organization and the number of people we serve, is how do we keep quality at the forefront of what that is?
Absolutely.
And quality is what the person receiving services believes quality is, not necessarily what I or our team thinks quality is.
That's
right?
important.
And so how
Very
do we
important.
dig sort of deeper in that? And I really believe that there can be a focus, and just because you're a larger organization doesn't mean that quality can't be there. And so I think that, and keeping people we serve at the center of that and really thinking about that is sort of is a piece of that. The other is really thinking about how do we continue to sort of evolve and be nimble and flexible as we navigate into the future.
Okay. Jonathon, what elements of the mission, vision, and values how will you define them in the next 65 years for Fello?
So I think as we look to the future, we're really going to be really focused on how are we meeting the needs of the communities we serve. So Maryland and all the communities that we're in are unique and different. There are similarities, but at the end of the day, we want to be hyper-focused on what those needs are and how do we best meet the needs of people with disabilities in those various communities. And so we'll be really focused on that.
Great. Okay. Well, so this begins the 65th year. It's going to be a year-long celebration.
We will be celebrating all year long.
That's it. That's the way I want my birthday to go like that as well. I think it's a fair request.
A lot of people in my family believe that their birthday should be all year long as well.
There you go. So I guess the question is, people are going to be seeing this. They're going to be excited. They're going to want to share and get involved. Yeah. And so how could our listeners get involved? How could they help celebrate this momentous occasion?
So staying engaged. So going to fellow.org, signing up for our e-newsletters and other email announcements of things that will happen throughout the year around that. We obviously will be doing something connected to the anniversary each and every month around that, which will be really exciting. Some signature things that will be happening is our sort of golf tournament that raises money for our children, youth, and families programs that isn't funded by government at all. And so those community members. But we'll be ending our 65th anniversary year in October with a huge celebration at Live Casino in their event space. And so we'll be honoring some people from our past, our present, and some people who are focused on our future at that event, as well as just celebrating the accomplishments that we've accomplished together with the communities we serve. And so we're really excited about those things.
Well, Jonathon, thank you very much for being on the show today and helping us celebrate this momentous occasion, 65 years. And for all our viewers, we hope you've enjoyed this episode of Fellows Thinking Differently podcast. I'm your host, Alex Ficcari, and we've had Jonathon Rondeau with us. We hope to see you next time.